Hi everyone, this presentation covers Chapter 10 on Case Control Studies in the third edition of Jacobsen's textbook, Introduction to Health Research Methods, a Practical Guide. In this chapter, you will learn that a case control study compares the exposure histories of people with and without a particular disease in order to identify likely risk factors for the disease. Here's an outline of the chapter. Section 10.1 provides an overview. Section 10.2 covers finding cases and controls. Section 10.3 covers matching. Section 10.4 covers minimizing bias. Section 10.5 goes over odds ratios, and Section 10.6 covers matched case control studies. Section 10.1 Overview. So a study that compares the exposure histories of people with the disease and people without the disease is a case control study. So you start with knowing their disease status. A case is a participant with the disease of interest. So this could be an infectious or a parasitic disease, non-communicable disease, injuries, any other health condition of interest to the researcher. A control is the participant who does not have the disease being examined. So you wanted to compare these histories of exposures among those with the disease to those without. Participants in a case control study are selected for inclusion based on their disease status, as I just mentioned. Both cases and controls are asked the same set of questions about the past exposures. Figure 10.1 goes over the key characteristics of a case control study. The objective is to compare exposure histories of people with a disease, the cases, and people without the disease, the controls. The primary study question is something like, do cases and controls have different exposure histories? The population includes cases and controls that you want to be as similar as possible except for their disease status. So one thing you want to think about with a case control study is when you would want to use this approach. This is often used when the disease is relatively uncommon, but a source of cases is available. A requirement is that source of cases to be available. Then some of the first steps to think about are to identify a source of cases, assign a case definition, decide what type of control population will be appropriate, and decide whether cases and controls will be matched. Something to look for though here is recall bias, and we'll go over matching and recall bias in the next few slides, as well as the key statistical measure, the odds ratio. So figure 10.2 goes over a framework for a case control study. And it's a really nice setup here broken up into two different steps. So the first step is to determine what is the individual's current disease status. And so if you think about it here, you can have individuals who are cases, who have the disease, or controls, who do not. And then step 2 is to look to see if the individual has an exposure at some point in the past. So they can have the exposure and they cannot. However, you could have the disease and have the previous exposure, but you could have the disease but not have the previous exposure. Same thing with the controls. You could not have the disease but be exposed to something, or not have the disease and not be exposed to something. Section 10.2 goes over finding cases. So the first step is to identify an appropriate and accessible source of individuals who have the disease or disorder of interest. So the sources that may be able to assist researchers really are meant to meet the case definition, but usually they're through clinical resources. So these would be hospitals and specialty clinics, physicians' offices, maybe a public health agency, a disease registry, or disease support groups. The next step is to select an appropriate source of controls, and this could be friends and relatives of the cases or other hospital or clinic patients without the disease, or it could be members of the general population. But it's important to remember that you want the cases and controls to be as similar as possible, except for their disease status. And so you must come up with a control definition, which is the eligibility criteria for inclusion in the comparison population. The inclusion and exclusion criteria for cases that do not specifically relate to the disease must also be applied to the controls. Section 10.3 goes over matching, and so there's some different ways to match. There's a lot of different strategies for matching. Some people like it, some people don't, but it is a tool to help minimize bias in research studies, particularly case control studies. So matching, in general, is the process of recruiting one or more controls demographically similar to each case. One type of matching is called frequency matching, or you could also see it in the literature as group matching. And this is a sampling design that ensures that cases and controls have similar group-level demographic characteristics. A matched pairs matching, or individual matching, is when the sampling design links each case to one or more controls with similar characteristics. So group level, individual level. Individual level could be genetic siblings or twins, but if you just think about it in that way, that frequency matching is group matching and then matched pairs is individual matching. Many case control studies, however, do not use matching. Some people think that it introduces a different sort of bias, whereas others think it may reduce bias. Also, overmatching could occur, and so sometimes they will have a case and they may have 3 controls for that. And just some things with the overmatching, there's recruitment challenges and possible statistical bias when matching on too many different characteristics. So instead of just matching on, say, sex, you may match on sex and age, then you may match on sex, age, and education level, but then you get into, are you really matching these people with that same background? Section 10.4 goes over minimizing bias. So this is one of the first times in the textbook that Jacobsen discusses bias, and bias is a threat to the validity to all study designs, not just case control studies. This is a systematic flaw in the design, conduct, or analysis of a study that can cause the results to not accurately reflect the truth about the source population. The key word here is it's a systematic flaw. So it's a flaw that's done methodically, orderly, and routine. It's not something random or that happens due to chance. And so 2 types of bias that can be common in case control studies are misclassification bias, and this occurs when participants are not correctly categorized as a case or as a control. So some controls may accidentally be called a case, and some cases may be incorrectly classified as controls. Also, because in case control studies you're usually asking about exposures in the past, they may suffer from recall bias, and this is bias that occurs when cases and controls have different memories of the past. Section 10.5 goes over odds ratios. Odds ratios are used not only in case control studies, they can be used often in cross-sectional studies, although some people would report them as a prevalence ratio. But odds ratios really are looking at probabilities. And you're looking to see the likelihood that an event will happen. And these are on the scale of 0 being the low probability that an event will happen, and the event in a case control study would be the exposure, because you're looking at the exposure and already know the disease. A high likelihood of that is 1 or 100%, and so it would be a high likelihood that they've been exposed. And mathematically, probabilities are typically written with the Greek letter for P. Then Jacobsen also includes in this set of slides some definitions that go with some of the calculations for these topics. So the odds is a single number calculated as a ratio of the likelihood of an event happening, so that's our P on the top, compared to the likelihood that it won't happen. And so the odds is P over 1 minus P. Now when you think about odds, you may be thinking about horse racing. And so a horse with an equal chance of winning a race is 50% likely to win. He's also 50% likely to lose. And so if you take 50% and divide it by 50%, your odds are even. So the odds are 1.0. And then figure 10.3 goes over the odds, and it shows some of the different distributions of how the odds are calculated. So I'll let you go over that on your own to familiarize yourself a little bit more about how to calculate odds. So odds ratios really are a measure of association. So they are that proportion. It's a number that summarizes the relationship between an exposure and a disease outcome. Now technically the odds ratio is considered the ratio of the odds in which the denominator represents the reference group. So for a case control study, the odds ratio is the ratio of the odds of exposure in the cases, which is the numerator, and the odds of exposure among the controls in the denominator. So odds ratios really are represented well in a 2x2 contingency table. And so this is a table that's actually similar to that very first diagram in this chapter. And it's a row by column table that displays counts of how often various combinations of events happen. And these are usually divided into yes/no categories. So in an unmatched case control study, the columns usually are the disease status, so yes case, no control, and the rows are the exposure status, so exposed yes, unexposed no. And so it usually looks something like this. And so we have our A, B, C, and D like we had before here. Our disease status is across the top. Our cases are the first row. Our controls are the second, or the first column. The controls are the second column. Then we have our exposure status in the rows, and then we have our exposed going across the top, unexposed here. So A represents people who are cases who were exposed. B represents controls who were exposed. C represents cases who were not exposed. And then D represents controls who were unexposed. And so the odds ratio is A over C divided by B over D. Then algebraically, you can get into A times D over B times C. And then this section goes over basically that same calculation. Jacobsen brings out that odds ratios are a point estimate, and a point estimate really is the value of a statistic in a study population. So an odds ratio, a relative risk, a prevalence ratio, these are all point estimates that are calculated. And then the rest of this is what I just showed you in the previous 2x2 contingency table. And here's that calculation again with interpretation. So you might be thinking, okay, well, what does that mean? If the odds is 1, the odds of the exposure is the same for the cases and for the controls. If the odds ratio is greater than 1, the cases have greater odds of exposure than controls, implying that the exposure is a risk factor. If the odds ratio is less than 1, the cases had less odds of exposure than the controls, implying that the exposure was a protective factor. However, point estimates are typically presented with 95% confidence intervals. So you don't normally just see an odds ratio on its own. because then it doesn't give you a statistical significance value with it. So typically, statistical software, it can be done by hand, but you usually use the statistical software like Stata or SAS to do this. But 95% confidence intervals will go along with it. If the entire confidence interval is less than 1, the exposure is deemed to be protective. If the entire confidence interval is greater than 1, then the odds ratio is deemed to be risky in the population. And if it overlaps and crosses 1, which I'll show you in the diagram in just a moment, the odds ratio is not statistically significant. So therefore you can say the exposure and disease are deemed to not have an association in the study population. And so figure 10.5 goes over these interpretations. So here at the top here, this represents no association. Our odds ratio is 1.3, which is right here. And then our 95% confidence interval is 0.1 or 0.6, which is less than 1. This line right here is called the line of no effect, and that is meaning there's no difference. But because it crosses 1, and then it's higher than 1 at 2.5, there's no association here. Now here we have cases have significantly lower odds of exposure than controls. The odds ratio equals 0.6, which is here. 95% confidence interval is 0.4 and 0.9, so the exposure is considered protective. Here, this one is an odds ratio of 1.7 with the 95% confidence interval of 1.1 to 2.6. Cases have significantly higher odds of exposure than the controls, so the exposure is considered risky. So you can also use some other statistical methods, and these include the chi-square test to calculate odds ratios. And you can also calculate 95% confidence intervals for the chi-square test, or calculate a p less than 0.05. And we'll go over a lot of the statistical terminology more in the later chapters. When the 95% confidence interval overlaps 1, the p-value is meant to be represented as greater than 0.05. So then it indicates no association or difference between the cases or controls. And so 10.6, figure 10.6, goes over the examples of odds ratio calculations. And here you can kind of see some different ways of doing it here. So looking at the odds of exposure among the cases. Okay, so we're looking at different exposures here. Then you can look at the odds of exposure among the controls. Then you can look at, you have your odds ratio here, and then your chi-square test, which is a much more complicated calculation, and then a p-value here. So case-control studies are able to estimate the odds of exposure among the diseased and the not diseased. But what is important to consider is that because the study population is usually not representative of the community as a whole, case-control studies are unable to estimate rates of the disease among exposed and unexposed, right? Cases are preferentially recruited. You know their cases already, so you can't really tell what the rate of disease is in a population in a case control study. Then finally, section 10.6 goes over matched case control studies, and it talks a little bit more about pairs and setting up 2x2 tables with pairs. These are representing not just one case with the number in the table, but the pair of cases in the table. And here we have two different types of pairs. We have the concordant pairs, and this is when the case and the control have the same exposure history, or discordant pairs when the case and control have different exposure histories. A matched pairs odds ratio is just a specific type of odds ratio that is calculated very similar, except for you're using the pairs within the calculation. So figure 10-7 goes over that matched pairs odds ratio here. So you have the number of cases and then the number of controls, the different pairs that are exposed, the controls and the cases, and then the unexposed controls and the exposed cases. Then you have the exposed cases and the exposed controls, and unexposed cases and unexposed controls. So a matched pairs 2x2 table can be converted also to an individual level 2x2 table, but it should give you pretty similar results for the point estimates. And so you want to have the total number of cases and controls in the individual level match half of what the number of pairs would be. And so you would just set it up very similar to the following here. So here you can see in the matched pairs table, you have 20 pairs of exposed cases that are also exposed controls here. And then you have 40 exposed cases that are unexposed controls. These are pairs, of course. And then you have 10 unexposed cases and that are also exposed controls, and then here you have 30 unexposed cases that are unexposed controls. And so you have 100 pairs here, but then when you break it up into the individuals, you will have the individuals are 200 here. And then you can see how the odds ratios are pretty close to each other. They're not quite the same, but they're both statistically significant and have a range that's fairly similar there. So that was it on case control studies in a nutshell. There was a lot of new terminology in here on statistical testing and doing some different calculations that will all be brought up again in the later chapters. So stay tuned. Thanks for listening.